Good afternoon to everyone. I'm delighted to welcome you all to today's important webinar on addressing mental health challenges in higher education institutions. So as we all know, the mental health is one of the most critical areas of focus for academic institutions today. So in the ever-evolving landscape of higher education, where students face numerous pressures from academic performance to social adaptation, mental well-being has emerged as an essential pillar of academic success. So this webinar brings together distinguished leaders and experts to share their insights on how we as a community of educators, administrators, and thought leaders support students and faculty in navigating these challenges. It's a privilege to have with us a panel of esteemed academic leaders who are leading the change in building a healthier and more supportive environment for students within their respective universities. So we are at a crossroads where proactive measures and thoughtful dialogue are more important than ever. So the aim of today's discussion is not only to address the challenges, but also to share best practices and strategies that can make a tangible difference in the lives of students and faculty alike. So before we begin, I would like to extend my heartfelt gratitude to all our speakers for being here and for contributing to this very important conversation. So their expertise and commitment to improving mental health in higher education will no doubt provide invaluable insights for us today. So with that, let me introduce our distinguished panelists and get the discussion started. So the moderator, session chair for today is Professor Dr. Gopal Pathak, who is also the Honorary President of CIPU. So Gopal Pathak graduated in civil engineering from BIT Mesra in 1977. So he completed his master's in civil engineering and PhD from the same institute. In 1980, he joined the Department of Civil Engineering at BIT Mesra as a faculty member and rose to the position of professor in the year 2000. Apart from his experience in the academic field, he has also held many administrative positions, including HOD of the Department of Civil and Environmental Engineering, Dean of Student Welfare, Dean of Faculty Development, Dean of Administration and Campus Development, and others. He has also served as acting Vice Chancellor of the Institute. Professor Gopal Pathak has published and presented many technical papers in various national and international journals and conference proceedings in places such as China, Switzerland, Sweden, Finland, Australia, Iran, South Africa, and USA during his professional career. He has also been a visiting professor and scholar at many prestigious foreign universities, to name a few: University of Technology, Sydney, University of Ningbo, China, Princeton University, USA, International Institute of Water and Environmental Engineering, Burkina Faso, Western Africa, and Stanford University, California. So he served as Vice Chancellor of Jharkhand University of Technology, Ranchi, from 2017 to 2020, and as Vice Chancellor of Sarala Birla University from 2020 to 2024. And he has been heading Sarala Birla University as Director General since August 1, 2024. So the first panelist for the day is Dr. Madhu Chitkara. Dr. Madhu Chitkara is the Pro-Chancellor of Chitkara University, Punjab, and she is a distinguished leader in the field of education with over 4 decades of experience. And she holds a PhD in education and has played a pivotal role in shaping the university's industry-linked programs and fostering global academic collaborations. Her vision has led to the establishment of numerous initiatives, including incubation centers and a network with over 200 institutions worldwide. Dr. Chitkara is also renowned for her dedication to women empowerment in education, having received multiple prestigious awards, including Outstanding Higher Education Leader 2020, Rashtriya Shiksha Ratan Award 2003 by All India Business Development Association, New Delhi, Nurturer of Talent Award by Second Asia's Best B School Award function, Singapore, Rajiv Gandhi Shiromani Award by Global Economic Council, Southeast Asia Award for being one of the most successful entrepreneurs by Washington School of Business, State Award Women of the Year 2012 by Dainik Bhaskar, and the Indo-Malaysian Highest Civilian Award of Excellence. Her inspiring leadership continues to impact young women and educators globally.
Thank you.
Thank you. The next speaker for today is Professor Dr. Jyoti Bindal. Dr. Bindal has over 42 years of clinical and teaching experience in obstetrics and gynecology, and she is a clinical authority on high-risk pregnancy, advanced laparoscopy, hysteroscopy, oncology, HIV/AIDS, and medico-legal fields. Professor Bindal is currently Vice Chancellor of Sri Aurobindo University, Indore, and earlier she has served as Dean of Medical Colleges of Shivpuri and Indore, Director, Gwalior Mental Hospital, and consultant to Armed Forces of India. Dr. Bindal has headed the Department of Obstetrics and Gynecology in medical colleges, where she has been a pioneer in many new initiatives related to maternal health, such as obstetric intensive care unit, obstetric high dependency unit, guidelines for healthy referral protocols from periphery, and protocols to abolish unsafe abortions, etc. And she has been a thesis guide, examiner, and mentor to over 250 postgraduate students. She has authored many chapters in textbooks, publications, and journals. And she has conducted various research projects. And she was the recipient of J.G. Jolly Award for her recent project on umbilical cord blood. So, and the next speaker for the day is Dr. Shashank D. Dalvi, who is currently the Vice Chancellor of MGM Institute of Health Sciences, Navi, Mumbai. Dr. Shashank is an eminent educationist with vast administrative and statutory experience of more than 41 years, a member of Board of Management at MGM University, Aurangabad, and Dr. Homi Bhabha State University, Mumbai, member of Academic Council of Dr. D.Y. Patil University, Pune. He was the former Vice Chancellor of Pravara Institute of Medical Sciences, deemed to be university, from 2012 to 2017, and community medicine specialist, having worked in government medical colleges of Maharashtra, on deputation for 1 year as registrar and as dean of faculty of medicine for 6 years at Maharashtra University of Health Sciences, Nashik. So, as a principal investigator for the use of pentavalent vaccine, a multicentric study of Serum Institute of India, Pune. He has published research articles in national and international journals, and he has worked on many inspection committees of MUHS Nashik, DMER Mumbai, and the Medical Council of India, New Delhi. He has visited many foreign universities for academic collaborations, and is a member of Board of Studies, Faculty of Medicine, Academic Council, Management Council, and Senate at MUHS Nashik from 2006 to 2012. He is a member of Medical Council of India and worked as an Executive Council of Medical Council of India, a winner of Sharidini Dhankar Best Teacher Award of MUHS Nashik in 2010, and is also winner of Rajiv Gandhi Education Excellence Award for Outstanding Achievements in chosen field of activity, New Delhi. So I once again thank all the distinguished panelists, and thank you so much for accepting our invitation, for being here. And now I invite Professor Dr. Gopal Pathak to set the context and moderate the session. So participants can post your questions in the chat box. So when the discussion happens, and if time permits, at the end of the session, we'll be able to take up a few questions, and or at the end of the session, you can also unmute yourself and ask the questions. Thank you so much, and over to Dr. Gopal Pathak. Thank you.
Yeah, thank you, Mr. Karthik. And I welcome you all again, Dr. Madhu Chitkara, Professor Jyoti Bindal, Professor Shashank Dalvi, for this important session. And we are going to talk about the mental health challenges in higher education institutions and how to address it. That is more important. Issues are definitely there. Across the globe, if you analyze, you see the data, you will find like one report from American College Health Association. America is facing lots of problems with this issue, India, of course, and all the other countries. For their data says 60% of students have been reported experiencing overwhelming anxiety due to many reasons. 40% of the students reported symptoms of depression that hindered their academic performance. Suicide is again the second leading cause of death among individuals, maybe due to various reasons. And similarly, among the faculties also different kind of issues, administrators, there are different kind of issues. So you will find it's stress due to different reasons in different groups, whether it is student or teachers or administrators. Here I would like to share one thing. When I was in BIT Mesra, it was the year long back, 1993, I was a young teacher. One evening, I was the superintendent of one hostel. One student simply came to my house and informed that room number 264 or 265, one student is very seriously sick. I rushed to his room. I saw lots of blood on the bedsheet and also on the floor. Other students, they ran away. First thing, immediately I could guess something, but I asked him, what's your name? From the beginning. I was also new as a superintendent in that hostel. I told him to show his hands. He was putting his hands behind. Then he showed me the right hand first. Then I told him, show the left hand also. So there were 12 cuts from the blade. He tried to attempt the suicide and all. There was no time. I simply told him, Khanna, he told me the name, Vinith Khanna. I said, Khanna, let us go to the hospital. Then he said, what for, sir? I am okay. Then I said, no, you are not okay. Let us go to the hospital. We will chat on the car. Two, three other students, I told them to come on my car. We went to the hospital. Everything went on smoothly, but whole night somehow, some surgery, they did it. When he came back, here is the turning point for me also. Around 6 a.m., we went to his room. I told everybody to go out. I asked him, Anna, why did you do it? Why did you do it? The line which came, he was a second year student of electronics and communication engineering. Sir, I'm a loner. Nobody in this world is mine. I am all alone. And why should I live this kind of life? Then I asked him, what about your family? Some background I took. He had some bad experience from the family also, but he used to love his mother. I told him, this is one good reason why should you leave and take care of your mother. Then many more things he told me, because that here the issue was when I asked him about his GPA, it was good. I said, you are good in studies, so there should not be, no, from study side, I'm perfectly all right. But she, one-sided love she was in. And the girl that day told him something like that. And the boy became so emotional, he tried to finish his life. Of course, whole day when he recovered, counseling went on from my side. I was not a regular counselor. I was a superintendent and a professor of civil engineering. But I discussed with him so many things, his personal things. No, no one is my friend. I'm all alone. And then I said, just for to give him some uh, to better feeling, I told, so Kana, I am 10 years older than you. So we can also be friends. If you are in depression or feeling something bad about your life and you want to finish your life, you can come to my office, you can come to my house, and you can share with me. And every problem has got a solution in this world. And this is a message from my side to everyone. All the problems have a solution. Only we have to understand it and deal with it accordingly. So that counseling somehow it worked. He graduated from that institute and he left. Similar many type of cases I found. Study is one thing, academic performance is bad, so they are under distress. Parents are also telling them, discouraging them many a times. You are not performing well. One student had told me today, my dad told me, you are good for nothing. Why should I give you money for studies and all? He was upset. But some encouraging words, soothing words change their life also. So my perception is the cause of depression could be 10 things. And at this present era, when lots of advancement in technology is there, even in the school age, I've heard, that is not my personal experience, for one mobile which father was not giving to the child, he was under depression. He was feeling like all my friends, they are having Apple mobile and this mobile. So these materialistic things are also have impact in our social life. University, as far as you are concerned, the anxiety for your career, marks you are getting less, placement scenario, others, all your friends, they are getting some job, you are rejected by some 5, 6, 10 companies. They need proper counseling. Even among the teachers, how many publications you have made, we also ask how many projects you are dealing with, how many, what is the amount you could get. So those factors are definitely required for their promotional avenues and all. So under pressure, and they have to manage their professional front as well as personal front also. So these are the things which are causing distress. Many other factors could also be there once they graduate and all, but I'm talking particularly about the university at present. Once they graduate, loan or something somebody has taken, even among the faculties and other officers and other staff members, they have taken loan. So this materialistic competition that is really ruining our lifestyle. We are learning many things from the West, where only and only wealth has got importance. If you have money, you are a very big man. Indian philosophy is something very different that I will discuss at the end. But here, what I wanted to start with, for mental health challenges, academic pressure is one of the component. Social and financial stress is also one of the component. And even if somebody knows that he or she is having mental sickness, in Indian society particularly, that is a stigma. Like if somebody is going to a mental health consultant in America, it is very often they know and they go up. Those who are having problems, whether they are alone or some financial stress due to financial reasons, stress due to academic reasons, they consult someone. But here we find, like if I'm going to Kake Mental Hospital in Ranchi, where I stay, Kake Mental Hospital is quite famous. Many of you may be knowing also. But they always feel uncomfortable to going to a mental hospital. They feel like that is a stigma. I will be treated as a mad person or something like that. So that also awareness need to be there. In Mumbai, maybe many persons they would be coming to your hospital. Ranchi, when I was in BIT Mesra, it is one of the premier institution of the site. I had asked some students, you are having problem, why don't you go to consultant? They said, no, no, my mother was telling, don't go to Kake Mental Hospital and all. Privately, they would make a visit to some doctor, whether he is a competent or not. But that is a stigma in this society, this part of India, at least I can say. So these issues are, of course, a burning issues. So may I request one of the speakers, panelists, need to start with Dr. Madhu Chitkara. What is your experience in your university as an administrator and academician? You have served the university for a very long time. So what's your personal experience and how to address these kind of issues? So over
Uh,
to
yeah, so I think great, you can say, introduction to the topic given by Professor Pathak. I think whatever you discussed during this, and you gave some example also that personally you were able to solve that problem of the student and who was doing something. So what we have done is in our campus, and I think the all the listeners who are there, everybody is doing something very great in their organizations, and we have to learn from each other that what are the best practices they are using for this mental health. So especially I have noticed, because I am into education for the last 48 years. I started teaching in 76. So it's I have seen the generations changing their mindset, and how in our times we were not never knowing about even the spelling of depression, and now a child of 3 years also say I am papa, I am in depression. So I think this word has become a very buzzword for everybody to talk about. So they start talking about that, no, today you have not done this for me, so I am very depressed. So I think that has become a word to be used by all our teenagers and all my students. So what we have done is in our campus, so our punchline is explore your potential. So we have given the different pathways to the students. Not everybody has to follow the same path. Now, for example, you said that the people are very worried and very depressed, even the teachers also, when they have to show their research portfolios, or when they have to show their outcomes, that how whatever research they have done. So we have seen that everybody is not good in everything. So we have to give them whatever they are good in. So try to explore their potential. So we have given the different paths to the students as well as to the professors. Because who are the, because here in our organization, we need the people who can guide the students, who can mentor them, who can facilitate them. Now in our times, it is not that we have to give them only the academic support. Academically they are well read, because socially they are connected to each other. They have many platforms where they are doing on their own. But the only thing where we came to their rescue is that we are the great facilitators. But the problem is that our professors, are the facilitators, our mentors themselves are not trained in this mental health issues, because they are also not very much aware that how to, as well said by you, Pathak sir, that you were very new to that post and you were not knowing that how to counsel that child, but you tried your best. So we are doing a very regular sessions, especially after pandemic. So when they came back to the campus, they were good in EQ, but IQ, but they were very bad in EQ, SQ, HQ. So what is HQ? For in my case, they started. I think they stopped laughing. They stopped smiling after the pandemic. So the happiness quotient was very much missing in that their personalities. So we started with Dalai Lama Center of Happiness. This is the first university, I think we started with this center, going very well. So whatever the problems they are facing, so we are now trying this center, that every facilitator, every mentor, means every professor is to be trained in this center first. If they are trained, so every day whatever the problems are faced, they don't have to go to the counseling cell, they don't have to go to the mental hospital. First they will talk to their mentor, because they become the parent for them. So we have given 15 students to one mentor, where they can talk to them very easily, very openly. And if that parent or the teacher is not able to find the solution, then they come to our counseling center, which is very, very strong center, where then they come and they talk. And we have given that place to the center where it's not counseling center, it is a nurture nest. So we have given a very beautiful name to that, so that they should not feel very, I think, conscious that we are going to the mental center or to the counseling center, but they are going to the nurture nest. So where they can talk from their heart, they can solve their problems. So I think these are the small steps which we are trying to do that. Thank you, sir.
Okay. Okay, thank you so much, madam. So, as you said, lack of awareness amongst the teachers and whosoever stakeholders, that is no doubt. Everybody cannot do like that. At that time, I tried. I took him to the hospital. Somehow we survived, and things went on in right direction. But it could have been a failure also. Could have been a failure because the boy is very hefty. He was very strong, and also after even so much blood that drained out, he survived. Every time it is not going to be there. So 2 minutes I will also take to give you another example, I think everybody would like to have some idea about all these things. As a dean of students, after few years, when I became dean of students in BIT Mesra, and really I worked and I enjoyed the job interacting with the students, sometimes acting as a counselor also, though I was a teacher, a professor of civil engineering. One day I found, Sunday it was, I was driving, I found one boy coming from the thick forest. The campus has got many huge area of forest. He was coming from forest alone. I stopped my car. I asked him, so where are you coming from? Then he said nothing. I had gone towards the forest. I was surprised early morning. What is he doing in the forest? He was looking very down, depressed kind of thing that I had observed. I would have been wrong also. But I asked him, what is your name? And also I recalled when he was in first semester, he had played so well in cricket match and very good batting he had performed. I asked him, you are same Rajesh who had played cricket? He said, yes. Then I said, there is something wrong with you. Are you health-wise? Everything I asked hurriedly. Then I called him next Monday, you come to my office. When he came to my office, I asked him about all the aspects which I could have guessed. Affair, marks, everything, family front, everything was okay. Then I said, but Rajesh, you are not okay. So can you call your parents comfortably? They can come after a few days, 3, 4 days, not very urgent, but call them. I would like to meet your father. Here, I will tell you that also you would have faced as an administrator of your university. The guardian came to my room, father, of course. I told him, this boy is having some problem. Look at his fear. He's your son. Then he said, sir, I think you are having some doubt. He's all right. Then I said, his health, are you not concerned about this? He said, no, 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 I have got many works. I am not, please, unnecessarily, you are making it an issue. I told him, requested him, please take him to his house. He will be there for 7 days. Attendance and everything should be given to him. He can share something with you. Either he's having some mental problem or physical problem. Get it checked by a doctor, or he can share something with his mom if he's close to his mom. Normally, children, they are more close to mom. Exceptions may be there, but with father also there, some of them are very close. But he was adamant. No, 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 I'm going to take him, not going to take him to home and all. He should be in the hostel only. Then I said, are you not concerned if anything goes wrong with your son? Then he said, can you give me a piece of paper? In the meanwhile, somebody came to my office. I was busy talking with them. He gave me a paper and said, I think, Professor Pathak, this is okay for you. This is sufficient for you. When I read, he wrote, I so and so, father of Rajesh, roll number so and so, production engineering. I take full responsibility of my son. And the next line will say, hardly I think any father can write. If anything untoward happens to him tomorrow, I will be solely responsible for that. Institute will no way be responsible for that. And he told me, unnecessary, sir, you are thinking you keep this paper. I think you are satisfied. I told him, okay, I will keep it. But hardly I have met a father like you, not concerned at all. Anyway, he went. After 15 days, this boy was dead in his hospital room. He was into drugs. Drug is again, that is causing lots of problem in many of the hospital. I had no guts to call his father. I told some of my staff to call him and inform him what has happened. In the meanwhile, students, they start sharing. When I went to the hostel asking them how it happened, whole night he was taking some, what kind of drug, I don't know, but some drug he was taking. And then I came to know 3, 4 more boys, they are into it. So what had happened? An inquiry committee was set up after when he died. And the chairman of the committee, I am not naming all those big persons, but she asked, I think nobody is concerned about what is happening in the hostel. Then I said, as a dean of students, and our honorable vice chancellor was also there, I was also there. I said, Madam, if you allow me to say something, and please allow me, with due permission of the chair, I would like to say something. She said, yeah, by all means. I narrated him the entire story. And I said, if I would have taken him to a rehabilitation center, parents, they are writing, no, unnecessary, you are doubtful or not. In what way I would have proceeded? And I would like to know from the learned members of this committee, if you would have been in my place, how you would have dealt with. And then she agreed. Going to Kanke, which I mentioned, mental hospital, is a big stigma in the society because we are really not fully learned. Or America, everybody whosoever suffering, they go frequently to the consultant and take advice. Here, what I'm telling you, these are again the issues. While addressing these issues, this could be an issue. You have to have cooperation from the parent side also. Then they said you appoint some counselor. That is a general perception. If this boy or if anyone, if he or she doesn't go to the counselor, how will he come to know? That was a sheer coincidence. I was going towards that forest and I found him. I guessed. And that was in the comment also, member secretary wrote like, I think it should be well appreciated the way he handled. But other teachers, they should also learn from them. It is a simple line. It's not that easy. Lack of awareness and what Madam Chitkara said in the beginning, our faculty members or staff members, those who are dealing with the students, they also need to have training. They also have to have some formal awareness. Otherwise, how will they handle? Simply they are going to the classroom teaching. If you are observing all those students in the classroom, you may find 1, 2 faces looking like depressed, maybe a doubt. If he's all right, then nothing, it's fine. But if he or she has a problem that need to be dealt with, that counselor or dean of students office must be reported as per my perception. So now may I request,
Professor Pathak, I may add a couple of things here.
surely,
One thing is that I 100% agree with Dr. Chitkara and you that stigma and taboo even today remain one of our biggest challenges
right,
to the administrators of the institution. Having said that, the mental hospital which you mentioned at Ranchi, just for the knowledge of our attendees, there are 3 biggest institutes for mentally challenged people in the country declared by Supreme Court: Ranchi, Agra, and Gwalior. And I feel equipped to talk about it because I have remained 12 years the director of Gwalior Mansik Arogya Shala, which has been the biggest institute in our state for the mentally challenged people. So yes, taboo has been a very big factor, but here at Aurobindo, in addition to the academic pressure, and in addition to the post-pandemic stress, which Dr. Chitkara mentioned, I would also add a very strong factor as social media influence on children. Because somehow or the other, the words like anxiety, depression, and burnout have been kind of taken from social media influence.
Right, right. These
Yes.
generation particularly after say 2000 or so. Earlier also it was there, but the extent to less. Now, social media play a very important role in everybody, all the children. They get so much impressed by all those things, and even the societal scene when they see from the very childhood, they come across all those kind of movies and uh, even in their books also those kind of books are being published, but social media is playing a very important role. So very negative kind of impact the students they are having, and they are trying to copy it also. Particularly you see the western movies and all, even in India also, Bollywood also, you may find those kind of things. That impact, it is really, it is there. So may I request now
Yes.
Dr. Shashank Dalvi, lots of experience in this area. So we would like to have some ideas from your
Particularly,
experience
I will
and
like to
some.
answer. Yes, sir. I would like to answer what the issue that is being discussed. The use of social media, the large number of platforms, and the students are always busy on those various platforms.
Right.
Maybe the WhatsApp, maybe the Instagram, maybe the Facebook and everything. The students and how this awareness of IT revolution in the pandemic time, actually the IT on the online classes continued their teaching and they have escaped the loss of year. But these particular various platforms that they are using and how to use them in a positive manner, in a constructive manner, a proper lack of this particular knowledge in them, and as these are used by the various ways which will be detrimental to increase the stress factor in them only. And that particular stress factor is creating a large number of problems, even in the college premises also, institutional premises also. He has posted like this, he has posted like that, and all those certain things have happened.
Right.
I have some prepared one small PPT, not more than 5 to 7 minutes.
Okay.
So can I show that?
Yeah, surely. Please go ahead.
So these are certain, as per the topic, I have prepared this. As in the initial stage, you have asked about, these are the quoted figures about the young adults, that is the higher educational institute, the graduates, 18 to 25 years, particularly the 1 out of every 3 young adults is having some or other problems. And the young population is more vulnerable.
We cannot see your screen.
Just a minute, I will do it. Screen share. मीटिंग चालू आहे.
Yeah. These kind of issues.
Yeah. Is it visible now?
Yes, sir.
Yeah, thank you. So what has happened? This is just the example that that is not visible PowerPoint presentation, and everybody is in the stress. So such stress issue is the beginning of all the mental health problems. These are in the increasing in the school children also, certain trauma that they have seen in their families, in the class, outside also, and these post-traumatic stress disorders. Particularly, they should come out. A normal person's normally they should come out. But some students, they be under that trauma for a prolonged period. And then they need the guidance for that, the counseling for that. The anxiety is one of the most common issue. The depression is most common issue. And depression is going to be a major issue for disabilities. In all the countries it is present, and surprisingly it is more in the high income group. Rightly, I am coming for the treatment strategies. Why I will tell? Because there are all the mental health illnesses can be treated very well. They have to be identified. They should be considered like other diseases only, and they should be treated in a proper fashion. The drugs are available, the therapies are available, the counseling is available. Even such measures should not happen into the institute, such things. For that, the preventive measures can be used in the institute, like cognitive behavioral therapy, Jacobson relaxation technique. This is particularly the exercises for the particular muscles. The yoga, which is well-known method, the meditation. In our institutes also, we frequently observe, regularly follow certain procedures. Now, as Professor Pathak sir, in the beginning only you have mentioned the stigma or the lack of awareness that this can be treated, or tendency to hide the disease. That is the one thing that is there. Then inability to express, particularly, and stubbornness for the self-reliance. Even at some of the places, counselors are in short number. But the way, as it has been mentioned, that even though the counselor proper training is not available, the teachers should be motivated for this. Some short-term training program of the counseling should be for the faculty members, and then this can be used in a liaison in between the faculty and the teachers should be more. Even for getting the treatment, some of the individuals go to the hospital facilities, but the experience that they get there, that might be the bitter experience, and then they try to avoid that or hide such illnesses. Or many times people may not pursue that the mental illness, there is no need to be treated it like other illnesses. The students and the staff and the liaison in between, and the recognition of early signs, symptoms of the mental illness among the students. The mentor-mentee system in most of the higher education institutes, good higher education institute, that is being practiced. So early detection of the deviation of the student is very important for bringing him right on the track. The causes for the mental stress, financial stress might be there, social stress, digitalization and social media, academic pressure, substance abuse is increasing nowadays. Everywhere in the bigger cities, it is more. Now, what exactly happens to the higher educational institute due to this mental health challenges that are existing in that institute, and if those are not properly handled, that will lead to poor academics in those candidates, that may lead to the dropout rate, high dropout rate. The campus climate may become negative, which should not be there at any condition. Social stigma and social and economic impact overall. There are certain mental health challenges faced by the students, the workload and the role ambiguity, Job insecurity, this is particularly for the faculty, which are more true. Job insecurity and financial concerns, workplace relationships among themselves, work-life imbalances, resolving of the conflicts into the higher educational institutes among the staff members is of paramount importance, and that should be taken care at all the time. Now, how the campus can be supportive? Promoting awareness and reducing stigma, providing accessible resources, even including these mental health programs into the educational curricula, integrating mind-body interventions, creating peer support system. Our higher educational institute should be the healthy institute as such. Then there are certain strategies for supportive campuses for the staff, promoting work-life balances, building awareness and reducing, providing access to mental health, encourage stress management practices, strengthening institutional support. Building of good mental health is a vital aspect of holistic development of the student, child. HAI can create such campuses, adopt comprehensive strategies, and this will lead to a more productive society, ultimately. A large number of strategies to address mental health challenges in higher educational institutes, and accordingly, inclusive and harassment-free culture, promote extracurricular activities into the campuses. The various workshops for relieving stress, mindfulness, and self-care, encourage peer mentoring programs. There are certain good number of institutes, IIT, IIMs, Delhi University, where such programs are being followed at the campuses, but even at the higher educational level also, this is very important topic, and I am happy that today we are discussing this particular topic. So at the national level also, the priority has been given to this. In the NAP also, the number of programs on the mental health programs in NAP 2020 also, a lot of emphasis is given on the mental health, particularly in the campuses. I will refer to our institute, ARAM and AKAR. These are the two initiatives which one at Navi Mumbai campus and the other at Chhatrapati Sambhajinagar campuses are being adopted in our Biomedical Science Institute and in the Physiotherapy Institute, and there are good results of this, of those. The student clubs, a science and wellness club, particularly at Mumbai campus, this ARAM program, Heartfulness, Science and Wellness Club, and these are the some aspects which are more given stress under this club, the various activities, in addition to on Friday afternoon or in the Saturday, environmental aspects, physical aspects, social aspects. These are the certain aspects. These are certain photographs of those particular aspects where our students are joining these particular, and they are busy in other activities also. So the whole atmosphere at the campus that has been changed. As such, though to find the time for the preparation of the PPT, but one of the student which has suffered from such thing have helped me, who has come out from this particular thing, have done the PhD on the heartfulness meditation, has helped me in preparation of this PowerPoint presentation. These are certain awards received for this. The other is Akar. What we think, we become. particularly during the COVID, the new normal at that particular time, that has given rise to a stress among many of the students, even in the faculties, in general population. Certain culturally sensitive classrooms we have devised, particularly for the yoga purpose. Bullying should not be there at the campus anytime. This particular behavior, whenever such things are observed, those should be discouraged. Depression, extracurricular activities, academic leads, discipline, innovative self-directed learning, 360-degree development of the students can provide them way to vent their curricular, extracurricular, and holistic activities. These are the certain activities which are done in this AKAR schedule.
उनका busy वाला meeting भी है इनका. That will start slightly. इसके बाद वो meeting होगा. इसको let us finish.
These are the yoga classrooms, certain activities. Every day may not be good, but there is something good in every day. This is very good slogan that particularly in the campus, the number of events are occurring. But the positiveness of the mind and positiveness of mind, the culture of positivity among the students, among the faculties, that should be inculcated. That will help a lot. And overall, the bioeducation, that means all-round drawing from the best in the child, which has also made stress in the national education policy. So thank you very much. Thank you. Thank you.
Yeah, thank you, Professor Dalvi.
Yeah.
So what you have said, you have been a Vice Chancellor of MGM Institute of Health Sciences for a long time, and so much of experience you have. Depression is one thing, and distress, that is one thing. What Dr. Madhu, she also mentioned, Professor Jyoti also mentioned. What I would like to know, as a Vice Chancellor of that Institute of Health Sciences, are you considering those cases of schizophrenia and paranoia among the students? Why did I ask you? Anxiety is something else. Depression is something else. You are a doctor, you know better than me. But have you found those kind of patients among your students or any patients whosoever is coming to the hospital? The cases of schizophrenia and paranoia.
We are familiar with our students, even among the faculties also, such individuals, and those are being treated and those are working well. Those are doing well.
Sir, I would like to state here that schizophrenia is a distinct mental instability syndrome. And that in itself is not like a normal mental anxiety, normal depression, which can be treated by advice, counseling, mentorship, etc. It needs a definite medical treatment. So I think on this platform, probably we are looking at the tools where, as Vice Chancellors, we can help the children and the faculty to overcome their, I would use the word maybe mental anxiety, depression, etc. For example, very rightly, Dr. Chitkara mentioned about the mentor-mentee program. Now, in the medical colleges, by National Medical Commission, it's become compulsory and we have implemented that mentor-mentee program. Now, here the structure is, Madhu, this is going to interest you, is very, very different. So every one person, one faculty member is given only 4 mentees. So in the first year, those 4 mentees are there. In the second year, another 4 mentees will come. So now the senior 4 will become also the co-counselor for the junior ones. Like this, the step goes on. In an institution where we have 250 students, admission batch of MBBS, so you can see that almost 60 to 65 mentors are working for this. And then in the subsequent year, this number will grow on. So this is working beautifully. And I think every person who has face some kind of mental challenge is somehow finding solace in finding a person to whom he can go and outpour his trouble.
So I will give you one example that what research shows and what we have gathered from talking to the students, talking to the mentors, and talking to the parents even, and all the stakeholders. So we have seen that we have, and observed also, and I think everybody has observed, and the participants who are part of it, 108 participants are there. Everybody at a university level, they must have experienced that there are very common mental health challenges which we are facing. I think if I am facing, and my teachers are facing, and my university is facing, everybody must be facing, whether it is a medical college or whether it is an engineering college or whether it is any college. So
Absolutely.
first, I think first includes that is the stress, anxiety, which is very prevalent nowadays. They are very anxious. There are lots of anxieties. They are not stable. They can't sit at one point of time at one place. There's so different type of anxieties we have noticed. Then I as well already mentioned that the depression is always there. Then comes, academic performance comes very late. First of all, that it comes to stress, anxiety, depression, and then comes that what they are doing in academic performance. And the very important, and I think very pertinent in this, is the peer pressure, peer competitiveness, which was not there when we were students. Now when placement company comes, if somebody is placed in the first company, and I have seen that the others start crying if they are not placed. So we have to tell them, what is your destiny, you don't know. Maybe it is very, I think, something very good for you, kitty, your kitty is there. So if one company comes and giving the package of 6 lakhs and he or she is not placed there, now she or he becomes very depressed. Then other companies also start coming. So there was a great example where one of the students become very upset that I was not placed there. So we counseled them, because we see at the time of the placement activity that he was a little bit disturbed. So we said, and we handhold him that we will sure that the next company comes and it will be of your taste, and if it will be your caliber, you will be selected. And at the end of the road, the others were placed at 6 lakhs, 10 lakhs package, and he was placed at 22 lakhs package, because his destiny was different, his I think experience was different, and his skills were different, where that company was, and they took only 3 students, and out of those 3 he was the one. And then now we give this example to everybody at the time of placement, that don't be disheartened. For every place, everybody, there is a different place. So I think these type of pressures we have to take care. Then I think very commonly we have seen, and all of us have seen, that the socially they are not adjusted. That is why I was saying that SQ is very important, to make them understand that social quotient is very important. So I think now academic pressures, examination pressures comes afterwards. Now some of them have started going. I have seen in my campus, we have 3 incubation centers. Now 288 startups are sitting there. Now from day one, they come to our campus and they say, we want to have our own setup. We want to have our own company, because of the Shark Tanks, because of the activities like this on the social media. They have started seeing that now we will become the entrepreneurs from day one. Right. Now we have to guide them that what is a particular time when they are trained for it, when they are ready for it. So I think there are different type of pressures. So we at our place as an adults and as an educators, we have to tell them that how to make the work life balance, because which is very important both for the mentors and both for the mentees. I think these are the common problems which we all are facing, and now we have to solve this with the giving the specified examples. Well said by Dalvi Saab. I'm very impressed with your line that every day can't be good, but something can be good in
Yeah.
one day. So I think that is actually, we have to tell them, giving different type of experiences to them. So I think that is in my view. Thank you.
Yeah, thank you so much, Professor Jyoti Bindal. May I request Dr. Madhu now how to address this kind of issues? The issues have been well defined.
Yes. So I think what we can do is the first thing which I told you in the starting my talk, that very important is that there should be regular sessions for the mentors to attend, right? Then I think one of the speakers were saying that the senior students, now what we do, I will give you the special example. It's a in our campus there is no ragging, so it's a ragging free campus. How we do that? From day one, at the time of admission, when the student come and now they have to go to the hostel or they have to go to the classes, so their hand holding is done by their seniors. So now second year student, third year student is hand holding the first year student from day one, and they become the mentors for them. So it becomes a great ecosystem where we start, not only the teachers but the seniors also start mentoring them. So then they become their moral responsibility to take care of them. Even they are with that buddies, we say that now this is your buddy. So for 1 week, that buddy is with the freshers student, those who are entering the campus first time, because now you see the change from school education to the university education. When they are coming, it's such a different perspective of their thought, that coming from a very safe, very protective environment in a school, coming to a university which is a different platform where so many liberties are given to them, where they're open to talk, they can take any actions, they can take any decisions of their own, right? So then they become, I think they become very upset that how to handle those pressures. So at that time, those buddies come to their rescue. They take them to the food courts, they take them to the classes. Then in the evenings, they talk to them that it was okay, the whole day was okay with you. We also faced that. Then I will give you one example. So there was a custody in co-curricular activities. There is a dance troupe in our campus, which is custody. So they got many prizes on different platforms. So what they did was that since they were passing out, so they trained the junior students in their custody preps. Then the juniors did that for the first year students. So in that way, we have created the ecosystems where all the best practices are given to the juniors, and we have made the teachers and the professors part of it. Even the hostel wardens, that there are many hostel wardens, we have 10,000 students staying in the campus. So now they have become the guardians for the students, and they are treating them with these type of activities. So in the evenings we have skill works programs. In skill works programs for hostlers to attend, many languages are there, many clubs, so 32 clubs are there where they can improve upon their language skills, where they can, now for example, there is one great stress coming from the small cities. They have an impact of their mother tongue on their English conversations, right? So when they're communicating with the placement teams, when they're communicating in the market, so they become very stressed that since we are not very good. So we have made a different department where these skills are groomed. Then they have the co-curricular activities. Then they're going to the happiness centers. We have made the happiness lounges all across the campus. It is a 100 acres campus. Everywhere they can sit, they can talk, and even there is rooms where they can release their stresses with fighting with each other, with that you can say the activities where they can take out their stress. Evenings we have a T20 campuses, cricket matches. So I think these are the small activities where they all should be involved in something or the other. Then it can be, I think that ecosystem has to be created. We're
Okay,
trying
thank you,
our
Dr.
best. Yeah.
Madhu. And may I request Dr. Jyoti Bindal, would you like to add something to it? How to address these kind of issues? Something, some new idea or something? Would you like
So,
to add?
one is, we have an on-campus wellness center, like they have a happy institute, which is
Happiness
very
campus,
pivotal.
happiness center. Yeah.
Yes. So there we have free counseling and mindful sessions. Then partnership with NGOs, and there's a 24/7 crisis intervention hotline, which again helps a lot. Then, of course, as Dr. Chitkara mentioned, student buddies are a huge point of help. Then faculty members are definitely trained to identify the stress signs in students. We've also implemented mental health ambassadors programs. So students and the staff and faculty, they act as point of contact. And sir, one thing which I'm really thinking should be in the policy change for the institution should be that somewhere, or maybe at a higher level, somewhere we should have a co-curricular requirement or a mental health audit, or also a little flexible submission of deadlines, because we are so tightly structured that children are often under pressure. So, those kind of things like extended deadlines, reduced course loads, those kind of things may help the students, something like a broader integration of mental health into academic structures, like mental health credits maybe. So these are the things one can look into for in future. And of course, I always say that academic leaders have to lead by example, and they have to emphasize a balanced approach to work, studies, and mental well-being. I mean, to put it in a very blunt manner, if the teachers are fighting amongst themselves, it's so easy for students to understand the fight for chair, the fight for better facilities. All these things do percolate down in the students, and that is not a good sign.
I fully agree with you. Yeah. Anything else would you like to?
Particularly, I support what Madam have just mentioned, the faculty behavior in the campus that precedes, or that is the example which the students observe. The faculty should have respect among each others. They should respect their work culture and the respect among the faculty and their behavior among themselves. If it is respectfully, that is observed by the students, and that will be imbibed by them particularly. The counselors, particularly the training of the counseling, because always the clinical psychologist and the counselor shortage is there, the manpower, but some such training of the counseling to the faculty members, that will be also helpful. As Madam is also aware about this, the ATCOM module, which has been given by the NMC, they have made some effort to include this particular program about the mental well-being of the students. And in this ATCOM module, the efforts have been done in the medical field.
Yes, that's actually, it's a very good model if people are implementing it properly. I would also like to mention here that we are running an MPhil course for clinical psychology. So we do have qualified people, because they are the people who have already done post-graduation in clinical psychology or psychology and psychiatry. So they are the right people to help. And also, being a medical college, we do have MD psychiatry as a course. So we have a lot of trained faculty, we have PG students, residents, senior residents who've already done their PG. So touch wood, this way we do have a team of people to guide. But sir, I would strongly suggest, and I would like to use this platform to suggest that a comprehensive mental health audit should be done to recognize the gaps, to strategize the interventions. So that's one thing. And also we should do what we call tracking metrics like counseling, like utilization rates like feedback surveys, like reduced dropout rates, and overall student satisfaction. So that's one thing which many institutions lack. And of course, every student has to feel supported. That's very important.
So I think adding to Dr. Bindal's point, what we can do is at this platform we can tell to the listeners also and the other promoters that now we should start using the technology in mental health support. So I think technology is a great tool, and we can use it as a great help to us, because reason being that the number of students in campus becoming more and more, and it is not possible physically sometimes to guide them, to support them, to mentor them. So I think you can have some use can some apps. So we are using 2 3 apps there where 24 by 7 counseling sessions can be done at any point of time. Physically they are not seen by anybody that they are mentally disturbed or they want counseling, but using those apps, telemedicine services, I think in medical colleges everybody is using it. Now, I think AI is in use and everybody is talking about artificial intelligence. So why not to use AI driven tools? For example, we are using Visa and your Dost. Now, what they do is, first thing is that we got the data. So it is a data driven world now. So we should know the data, so that if one student is, or one teacher, sometimes teacher also need the counseling, if they are counseled, so that data will be given to the counselor, that 1 month back also he was counseled or she was counseled, and that was the outcome, how we did that, what we used, and if the stage of medicines were there, what type of medicines were given. So now we are using those personalized assisted apps where the student can talk to the mentor, where the mentor doesn't know him physically or he's not a teacher in the campus. So he is very comfortable. He knows that the person who I'm talking, or the app which I'm using, they don't know me personally, so they will not make something in their mind about me, about my personality, right? So it sometimes it becomes also a stress for the students. So using these digital solutions, virtual counseling can be one. Then we can have the stress management apps are there, and many online peer forums. So if you see the online platforms, you see there are many online peer forums where peers give them the guidance that we use that app and we are solving our problems using those apps. So I think that can give us the 24 by 7 counseling where these technology can be used for them.
Right, Dr. Madhu Chitkara, thank you so much. And it was a wonderful session, but time is less, only 4 minutes are left. So I would like to sum it up. Of course, initially, I would like to thank all of you, Dr. Madhu Chitkara, Professor Jyoti Bindal, Professor Dalvi, who all added really flavor to with his experience and all. You all did it. Maybe in future also, I will request Mr. Karthik to organize these type of webinars. And I would like to invite faculties, all the faculties, if at all it is possible, probably in a big room, and for you also, because whatever you have said should be known to all the faculties or all the stakeholders, even the students. They should also know, as you talked about the app. So here I would like to sum up, like for students, we have to have different kind of strategy, like as we data says, like for American Students Association, here also the variation could be there, but more or less 60% of students, they have been reported experiencing overwhelming anxiety due to many reasons: failure, finance challenge, affair also. That also I have told you many cases in BIT mess I had come across. One student fell in love with her teacher, and that was in depression. The kind of counseling he needed, and so many kind of things you also must have observed in your university. And suicide, that is again second leading cause, that we all have to fight for those kind of things. That should not happen in the society at all. For faculties, the mental health challenges which we all observe, and we should be concerned about that. Academic pressure, they have to publish so many papers, they have to bring grants, projects, and taking classes, evaluation, and also managing the home front. So personal life and professional life managing, sometimes it causes distress, particularly amongst ladies, because they have to take care of husband, children, family, and everything. So how to make a balance, and how to address, and particularly as you said, this media things, the role what media is playing now, the social kind of things what we are facing, particularly amongst the children, school going children. All the time they are busy in mobile watching so many things, and so many nasty kind of ideas also they are getting. So how to address these kind of issues? Faculties, as you all suggested, and I fully agree to it, they need to have some training once they go to the class. So awareness amongst the faculty. Otherwise, what happens in a routine way, they go to the class, they teach their subject and come back. They don't have neither time to go for analyzing every student who is in distress, who is in disturbed and all. So some awareness kind of program must be organized for the faculties. And counseling, as you said in the beginning, that is really very much required. At least, and what you said about so many activities in the campus, extracurricular activities. So that is also a place where you have a vent, you can discuss with your friends, you get involved in music, dance, or whatever hobby you have. So thank you so much, Mr. Karthik, for organizing this webinar. Thank you, each one of you, Dr. Madhu Chitkara, Professor Jyoti Bindal, Professor Shashank Dalvi, for a very wonderful input, what you gave. And in future, one session, definitely, Mr. Karthik, I would tell you to organize this kind of webinar, because time is less and many issues are still need to be discussed. So we can organize it after some time and all. So thank you from my side to each one of you. Special thanks to Mr. Karthik for organizing this webinar and giving me opportunity, inviting me over here. Thank you.
Thank you, Dr. Gopal.
Would you
But
like to
maybe we can take one or two questions, because there are many questions in the chat box.
Yeah,
I think
I've answered many of them in
yes,
type, if you
yes.
can note.
Yeah, some of them I think Dr. Bindal has answered, but I think Dr. Varadarajulu has raised his hand. Maybe he can unmute himself and he can ask his question. Another 5 minutes, with your permission, we can take one or two questions.
Yeah, good evening, one and all dignitaries on the platform. I'm really very happy to listen to all of you. I'm Dr. Varadarajulu, working as a Dean of Krishna College of Physiotherapy, Karad. It's in Maharashtra. So actually, in my 22 years of experience as a Dean of the college, if you see the basic reasons for mental health illness in the students fraternity is mainly because of the parents, I feel. So if you think in out of box, most of the problems are origin, if you see, it is from the parents actually. And that is one reason. And the second reason is the student teacher relationship. That is, we being the Indians, so we lost the Guru Shishya Parampara our tradition, because of the online mode. Teachers lost their importance in front of the students, and even if you mentoring them in however the good way, whatever they think, what this particular madam, this particular teacher is only good for me, and like that they will have their own choices among the teachers, even if you are planning for a mentorship also. So mentorship program also will be not of that much of usual, because they don't use the teachers for their knowledge, because the accessibility of the mass media, the Google and all, they get all the information. They don't consider the teacher as a teacher itself. So, and they act on themselves. You know, this generation is called as jet generation. So they think of themselves as if they know everything. So I think we need to plan certain thing where the teacher has to be given a prior importance, and the parents should be educated in the beginning of itself. That is what is my view on this. And since there is no time, I think in future the people who are here can take it my view on this and help the new generation to become
so
good.
quickly make
Thank you very much
Professor
for giving me the opportunity.
Jyoti Jindal. Professor Jyoti, can you answer this question? Or Professor Dalvi?
Yeah, I will
Anyone?
just like to interact with
Sure.
Doctor. You have asked very good question regarding the various problems which are existing among the students, but you have given the whole responsibility of the credit to the parents of the students. But at the campus particularly, always there is a multifactorial etiology for the any particular stress that, and there are stress removing issues are also there, and student, teacher, parent, the triangle and relationship and the interaction, all this will help to solve these particular issues. As you have rightly mentioned, this is the particularly at present what is the generation, that is the alpha generation, that is there at the campuses, and that is very advanced generation. And so we to the faculty to get aware about the problems of this particular generation and the techniques to solve this particular generation. The faculty update is also required, particularly say in case of attendance, because they are whatever the information they are reading on the mobiles and they may not be coming to the classes. So we have to find out the ways for these particular things and issues those are happening. But that is the very right concern that you have shown. Thank you.
So I would
Oh, thank
like
you so
to
much.
just quickly divide the question in two parts. One from the parent side and one from the campus side. For campus side, Professor Dalvi has rightly said, but from parent side, I think the very prominent reason, and I've just replied in the chat box also, nuclear family is number one. Increasing awareness amongst parents about the competitiveness of their children from other social parents, and having a single child policy, increasing age at which they got their parenthood. These are some of the, and of course, lack of understanding about the mental health at home are some of the reasons as far as parents are concerned.
And I
Yeah,
think
thank
the
you so
parents,
I
I
think
think,
Dr. Javed Khan has got some
yeah,
questions.
so Dr. Pathak, I think the one problem with the parents is this, which I have seen. I am also a mother, but parents see their kids to be very smart. They say that they know everything, and you are not evaluating them properly. So I think sometimes they become so possessive about their kids as the nuclear families are there. So the students are also, they say that we can't say anything to the student because they will become depressed. So now we are also sometimes become very conscious about that, how much we can tell the students or how much we can mentor them, because the parents come to their rescue. So if the parents are not there, it's so okay to talk to the students. So sometimes we have to guide the parents instead of guiding the students. So I do
Agreed, madam.
regularly talk to the parents that please don't do this. Now he is with us. We will take care of it. And whenever we need your support, we will call you. So I think somewhere in the line we have to take care of those stakeholders, which is the parents, which is very, very important.
Yeah, thank you, Dr. Madhu Chitkara. Your words are well taken.
Uh,
Time is very less. So may I request Karthik, one last question you
One
can
last
take
question.
at others
So
or
Dr.
over.
Javed Khan and Dr. Sandhya, they both have raised their hands. Maybe you can unmute yourself and you can ask your
Yeah,
questions quickly. Yeah.
am I audible?
Yes, you're audible. Please go ahead.
Okay. I'm Dr. Javed Ahmed Khan, Dean at Baba Farid Group of Institution, Bhatinda, Punjab. So my question is that, teachers in India, because I worked in various private organizations from Southern India to North India, and I give a FDP on stress management. So what I found that there's a lot of workload pressure which the faculty complain, not because of teaching learning. And for example, in my counterpart in Europe, so my friends in Germany and US, the teaching load overall is not more than 2 credit. And beside that, they do not involved in any other documentation, audit, or in I don't want to name the university. They mail in a morning, and within 10 minutes, every document they require. And they said, okay, if you have a class, leave the class. Document is more important. So certain private universities are running after the ranking, running after the audit, and the same thing happened with the mentorship. The mentorship, most of the faculty, if you take a survey, they think as a burden, they extra work. And I give one example. I was just checking my classes. So students were complaining to the mentor, sir, we have this problem, like this problem. तो उसने कहा हाँ मुझे भी problem होता है. तो उसने अपना पूरा कच्चा चिट्ठा कि मेरे को ये प्रॉब्लम चल रही है यूनिवर्सिटी के साथ, मेरे को ये चल रही है, he discussed salary issue to everything too, because he was so frustrated. So then similar outburst in the faculty a lot in various private and in the government sector also, because of the various. So how do you take this challenge? It's a reality. So well, I'll just ask the panelists
So I
that
think,
how you're able to take.
Khan sir, when we started discussing this topic, the start was that we have to mentor first our mentees.
Yeah.
So that was the first thing, that how they have to react to the problems shown by the students. And I think that is very, very important to first start this mentor-mentee system, that how these mentors will be talking to the students, what are the styles of talking, and what are the solutions they can give, what are the solutions which they should not give, and how they have to. I think that is very important, that portfolio to be given to them, and it is not a burden for them. We say that very natural manner when the student is coming to you. I'm not saying that, we are not saying that take the sessions or these periods are given to you, but by chance you are going into the corridors and you have seen any student, and you think that I have to mend some different skills in them, so do it, just talk to them. So I think that is only thing which we have to tell our regular sessions to the mentees, mentors, that please, these are the styles of counseling the students. So this is very important, I think, and that is the first job.
So,
Thank
Mr.
you.
Karthik, how
One
to say
last
that?
question, sir, maybe we can take. I think Dr. Sandhya has been raising hand from the beginning. So
Yeah.
maybe please unmute yourself. Last question.
Yeah, good evening to all. Thank you very much for a very interesting session. My question is that how to identify these, I am a dean of a newly started medical college at Navi, Mumbai, and we have right now 50 students. So this vulnerable students who can have these issues, so that from the beginning itself, if we can do something. I thought of a very novel idea of conducting coffee with dean meeting with these students. So every month we conduct, I am there with the students, and nothing academics, but all other details are talked to them. And we discuss with them freely what is their problem, anything happening. So like that free open session we are conducting. 2 sessions I have conducted. I just want to know any other surrogate indicators to identify that these students will be vulnerable to develop a issue like that, so that from the beginning itself we can do further counseling, further mentoring them, so that they will not go to that extreme stage of developing that mental illness. So this is my question.
So, Dr. Dalvi, would you like to answer this
Yeah.
question?
Now, at present, as the student strength is less, newly started college, so it is better to mentor-mentee program, particularly the observe, and if anyone is deviating right from, then in a year, the meeting with the parents, the communication of such deviated student to the parent, those will help in such activities if it is there. If not, then there is no problem.
Okay, thank you so much, Dr. Dalvi. So, Mr. Karthik.
Thank you so much. Thank you so much. A special thanks to all the panelists for joining today, and thanks to all the participants. And we look forward to continuing this conversation and taking meaningful steps forward, addressing mental health challenges in our institutions. Thank you so much.